So in your practice, what are you doing for knees? And you say a lot of these patients they go to an interventional doctor to try to avoid knee surgery or a knee replacement. So what are you doing?
I love treating knees. The reason is because it starts at the knee and then it destabilizes the other joint. So actually we have to do a full evaluation to make sure that the ankle hasn't taken an effect or the hip or even the lumbar spine. So we do a holistic evaluation, and let's say we diagnose osteoarthritis in an early stage.
Arthritis of the knee.
Arthritis of the knee, exactly.
Okay.
We can help with physical therapy or start the process of the prolotherapy to strengthen the ligaments, because all of the time a ligament becomes lax on one side and then it becomes bone on bone on the other.
Okay.
So we have to treat both sides of the knee.
What's prolotherapy?
Prolotherapy is the concentrated sugar but purified, and it creates an inflammatory response that actually strengthens the ligaments and tendons by up to 40%. So it's such a simple treatment, very, very effective.
So you inject the knee with this solution,
the
and
structure
what, the body
that stabilizes
to repair itself sends in like growth factors?
Exactly, yes. So things
and it rebuilds some things?
Rebuilds it stronger. So it's phenomenal. And that's for a minor injury. As it progresses, or as we get these patients on a later stage, we can do concentrated platelets or bone marrow stem cells. So if the injury is a little bit more severe, then we can extract blood and concentrate platelets. Platelets have growth factors in them. So as we inject them in the areas that they need it, they recruit these growth factors, the other cells, to regenerate the damage. So that's therefore the name of regenerative medicine, because we are helping the body recreate the structure.
So that's a PRP for the knees.
PRP
good for
knees.
arthritis patients, things like that, of the knee?
For arthritis, when it becomes bone on bone, they probably need the next level up.
What is that?
Which is bone marrow stem cells. Yeah, so if the problem is more severe than the PRP cannot handle, then we have stem cells, the bone marrow.
You like stem cells?
Phenomenal effects. Yes, absolutely, because it helps patients who are about to have surgery avoid the replacement of the surgery. I think up to 5 years, when they were qualified for surgery, 88% of those patients didn't need the surgery anymore after having stem cells.
But you say they're real stem cells that you're using,
yes,
implying that not all stem cells are stem cells.
Correct.
What do you mean by that?
There's been this movement that they are selling stem cells on a vial, and they don't necessarily need to be stem cells. They come in a powder. Like, there's no cells that are powder. So, but they don't.
They're not alive at that point?
No.
Okay.
They cannot constitute.
So what do you do?
We take the stem cells from their own body. So we aspirate from the bone marrow, concentrate them, and then inject them where they need it.
And it works?
And it works phenomenally.
Now, their own stem cells, what kind of a surgery is that? You're doing it?
I am doing it,
And
yes.
is it super painful?
No, you can do it under local anesthesia, and patients have minimum pain.
So you just take it, what, from the hip area?
Correct.
Pull the stem cells out, and then very quickly you have to put them into the knee or the shoulder or wherever? We're talking about knees right now.
Yeah, I mean, it takes to actually process that cell, those cells, around 2 hours to the staff. So we have a certified laboratory in our office and lab technicians that are trained just to do so.
And the results have been pretty good? I mean, for those that it works for, how good does it work?
Excellent. So they are able to avoid surgery, the grand majority. I think the data on the registry that we have is around 88% of the patients who have this bone marrow, they get to avoid surgery.
Okay, so I understand what the bone marrow is doing. Okay, so these stem cells are rebuilding what? Tendons? The muscles? All the above? Like, what is it doing?
In most of these patients, it's blocking the pain. So by the time you're bone on bone, the bone gets bruises, right? It used to have a cushion, and the cushion is no longer there. So what causes the pain is not the lack of cushion, is the bone is getting bruises or bone marrow edema or swelling. And that's what we target. That's what gets better. So the patient has no more pain.
So, but when you inject these stem cells, is it no longer bone on bone in some cases?
In some cases, it actually has been shown to regenerate some of the cartilage, but in all patients, or most patients, it will stop the pain, which is what at the end of the day matters.
A lot of orthopedic surgeons, or let's say, I'm not an expert, what could an expert disagree with you on this?
They would probably not believe that the cartilage will regenerate because it's been completely damaged.
But you have the published data to prove this.
Yes, but not on every patient. So not every patient will regenerate cartilage, but most patients will be relieved of the pain, which is what the patient needs.
That's the main thing.
That's the main thing.
Out of the pain. Do they go back to running, or do they have to take it easy for the rest of their life?
No. They go back depending on what stage of life they were, right? If they were not running before the injury on their knee, then they can go back to running. But if they were, absolutely, yes. Athletes who have problems in their ACL or a meniscus, before they used to be gone the whole season. Now it's around 2 month to 3 month recovery period.
I've
It's
heard,
still a long time, but
I've
not 6
heard
months.
that like the NBA is all over this. Like the pro athletes are getting stem cells treatments.
Yes, well, none is probably the PRP, the super
okay.
concentrated platelets. Unless they have a major injury, I don't think they will be doing the stem cells. But yeah, they are all over regenerative medicine because it helps them get back to the courts and the field a lot faster.
Have you had people that avoided a total knee replacement with some of these therapies?
Yes, that's one of the best outcomes is when we get to avoid those surgeries for them.